Hello, so welcome back to the SLP way, and it's been quite some time since I've uploaded some new content. Actually, I was trying my best to be as consistent as possible in at least this request videos, but unfortunately, I wasn't able to give enough justice to this side as I was occupied with a lot of other things that were going on. Anyway, without taking much of your time as well, I'll go straight to the point. So some time back I had received a request from one of the fellow SLPNs who is about to pass out and get her bachelor's degree. So the request was the treatment approaches for non-verbal children with autism. Okay, so that was the concern that the person had raised, and from my end, as much as possible, I'm going to share all the tips and suggestions and all the best possible treatment approaches, or basically the evidence-based practice that will give justice to the condition of your client. Okay, so I don't need to go in depth about what is autism. As we all know, it's a neurodevelopmental condition, and there was a notion some time back and even in the recent times where you are trying to cure autism. So that's not something that has been followed by professionals who follow neurodiversity affirming practices. Okay, so that's not something of your concern, that you're trying to cure something, because it's not like any other disease where you're trying to get rid of it. It's not like that. The concept is totally different. Neurodiversity affirming practice is a topic to be discussed on its own, so I would love to dedicate my time in discussing that in some other video. But let's get into the non-verbal part. So what do we mean by this non-verbal? Okay, so what I'm doing right now is a task of verbatim. Basically, I'm expressing my thoughts in the form of speech. I can also do that with gestures like I'm doing it. I can write it. I can show it in pictorial form as well. But the most common form used by the humans and for the convenience is speech, because it has its own benefits over the other modalities. But does that restrict us from only using speech? No. Like how you can see me in this video right now, I am augmenting my speech with my hand gestures as well. It's going hand in hand. It's not like my hand movement occurs first and then my speech is coming. It is happening together, and both of them together combined is conveying the meaning that I want to say. So when it comes to non-verbal, the first thing you need to get in your minds is that it's not like they are not communicating. It's just that the most convenient and the most generic way is not used by these children. Now, what's the most generic way? Is the speech. So they're not using speech, but it doesn't mean that they're not communicating. So as therapists, it's our detective work that has to be in action when we are trying to understand what is it that they're trying to communicate. You might see certain bodily signs, certain facial expressions, or certain behavior that triggers, or certain incident, let's say, that triggers their behavior. So that behavior is a consequence of something that has happened, and that is their way of communication. So we need to first understand right now at this level, at this baseline, what is their most common form of communication. It can be in any way, but understand that they are communicating and they are trying to say something. It's just that they have not chosen the verbal modality. When it comes to this, the first step in your treatment should be understanding where they are in the communication continuum. So they start from where, and there's nothing like one is inferior to the other. That means if they're using gestural, then it is inferior to speech. No, there's nothing like that. The point is, if they're communicating, it's great. It's just that we need to understand. The second most important thing will be now making the parents understand that this is their typical way of communication right now. So the parents need to be educated enough, and it doesn't happen in one setting. You need to counsel them over and over again. And that doesn't mean you have to be very strict and strong. You just have to be able to communicate this from your end very effectively and make them understand how they have to support this child. Because for you to facilitate the speech behavior, the child needs to feel at ease. They need to feel the comfort that, okay, this is my environment and I can explore the different ways of communication in this environment. If they're constantly scared, anxious, constantly being mocked for the way they are, they will never choose to adopt that. Now for you as well, just think about you. You're learning a new skill and you're just suddenly sent in front of a mob who are like professionals in that particular skill. How would you feel? You will get humiliated, you will get ashamed, you'll start feeling ashamed of yourself that you're not able to meet the targets, that it's a very unrealistic expectation to have from the person because you're just starting to learn that. So the same thing applies to the kids as well. They are in their own pace right now. So first we need to acknowledge what they have before we even jump and tell them that this is the other way that you can explore too. So that bonding between the child and the parent needs to be strengthened in the first place. That means as a therapist, our job is to first understand what is their form of communication, make this understandable to the parents, teach them certain strategies of how they can recognize this communication. If they're finding certain things very confusing, then definitely they can always reach out to the clinician, get their guidance, and then move their way ahead. Now during the therapy setting, we can't just stop the therapy there, right? As this is happening, simultaneously you need to introduce something called as the AAC, some form of communication. Now there was an earlier notion that you begin with PECS. PECS is nothing but picture exchange communication system. It's just a communication system. In my opinion, there is no harm in introducing that because that's just a starting point for you to tell them that there is another way of communication too, that is pictorial communication. But I would just not tell you that if you can avoid PECS, please do. If there is no other option left, yeah, you might have to end up using that because it's at least better than forcing speech out of the child's mouth. So you can always choose the PECS over forcing the child and pressing their lips, because I don't know, there are certain malpractices happening, and that's not something that is encouraging. So it's an urge to all the therapists to not fall prey for that, and it's urge to all the parents also to discontinue the therapy if something like this is happening with your child. So that's another thing. This is a topic that I would discuss separately, but I just wanted to put it here because I can't just skip talking about that. So that is first thing, but PECS has a lot of limitations. Firstly, the whole concept of PECS, it's reinforcement dependent. That means they show a picture and they get something in return. So now, for example, if it's an eatable, then literally the piece of a chip is broken down into small pieces, and for every exchange of the card, the child is receiving that. And that's just one way. Requesting for something is just a small part of language. Actually, language is a lot. Language is commenting, language is questioning, language is requesting, language is greeting. There are many ways, so we need to encourage all these things together. It's nothing like only the requesting skill comes before the pragmatic greeting skill. No, there's nothing like that. You are communicating in an environment which is very dynamic, so your exposure should also be dynamic. So the same thing applies to the child. So I would suggest that you directly start with AAC in high-tech devices, and there are certain apps which are freely downloadable. If you really want to know which all apps, then please just put up a message in the drop in a message in this comment section below, or you can go on my Instagram page and then DM me, and I can share the possible apps that you can download which are free for use. There are certain high-end AAC apps and devices wherein you need to purchase or you need to subscribe. So I'm not heading towards that direction because right now the awareness of AAC altogether in India is very, very, very poor. It's very poor. Only in certain metropolitan cities and few SLPs are practicing that, and the acceptance rate also is very poor. So we need to first start with something that is very feasible and then jump to something that is more at a higher end. So if you really want to know what are these apps, please comment in the comment section below, or you can just put up a message in the Instagram DM in my page, and then I can share the apps with you. So you can start with that, and it has to be used in a very naturalistic way. That means you're playing with the child, you are doing some daily activities with the child, and that AAC device is right there with you, and the expressions are coming out very naturally. So initially, that is the pattern, that the clinician or the parent are going to use the AAC device for every action or something that is happening. and pair it with a verbal output from the device. Don't expect anything from the child immediately. You have to use this AAC without any expectation from the child to say or even use it in return. So do not force the child's finger towards that and make them point. Yeah, of course, if they're trying to reach out and they're not able to, I mean, they bring their finger, but due to the certain motor weaknesses, and sometimes these kids also have something called as apraxia. So because of that, the execution of the movement becomes difficult for them. So if something like that is happening and they're trying to reach but it doesn't happen, then of course you need to provide some physical assistance. But make it as natural and very spontaneous for the child and not force it upon them. So my basic counseling for all the professionals, the budding professionals and those who are already practicing, is that first of all, get it right in your head that autism is not something to be cured. Non-verbal doesn't mean they are not communicating. If you're clear on these two concepts, 75% of your job is done. 75%, yes, and I'm not exaggerating. Yes, 75% of the job is done, because once you accept this, it's easy for you to educate the parents and push this concept further. So again, in a summary, in a nutshell, I will just summarize. Firstly, understand the child's communication level. The moment you see the child, don't just start writing the assessment report and finish it in one day. Take some time. Your assessment has to be dynamic. You saw the child for 1 hour in your clinical setup, in your hospital, in online modality, whatsoever. That's just a very structured and a planned setting that you see the child in. You don't know how the child was otherwise. So you need to have a dynamic assessment. What is this dynamic assessment is also a very important topic, and I will cover it separately. But understand that if it takes time for you to understand these different aspects of what is a child's way of communication, it's okay, just take it. But be all ears, your eyes open, your minds open, and then watch what is happening. And then all these things need to be noted down, so that the next step is educating this to the parents, making them understand that this is what the child is trying to do. So you have to do this in your home environment as well. Encourage this. Give them that support. Kids need that reassurance from the parents and of course the therapist that yes, I am being heard. So if they can feel that, only then will they move to the next step. So once that is happening, now all your therapy treatment regime is going to work out. So for a very young child, make sure you have a very play-based and child-oriented therapy. If they like the therapy to be done in a very dim light setting, please encourage that. If they love going down the slides, going on the swing, being in the sand pit, being in the ball pool, and the session has to be conducted there, please go ahead. Because the more the child is going to be enjoying what the child is doing, only then the child will be more attentive towards what you're trying to facilitate in them. So at that time, you can make use of the AAC. So don't keep AAC as a very last resort. That is not something I would suggest, because I myself have done this mistake, and I had to learn this lesson in a very bad way. So I encourage that your starting point should be with AAC. No harm. AAC is not going to hinder your any sort of communication. If it starts with non-verbal, it is definitely going to encourage the verbal communication as well. You need to be patient and consistent in your AAC treatment regime. Okay, and not just in therapy setting. You have to transfer the learned skills in the home environment and parental education. Home plans need to be structured and shared with the parents so that they can implement the same things at home. Okay, so I hope all these things are quite comprehensible. If you still have any further doubts, then we can have a one-on-one session and I can help you guide better with case capsules. So if you have a specific case and you're still stuck with it, then do reach out to me. We can plan some one-on-one consultation and I can guide you better. But for now, stay tuned and do subscribe to the SLP Way. Bye-bye. Take care.